Hi, I'm Mary Sue Rominger. I'm on the Board of Directors and a volunteer for the Bateman Horn Center. Welcome. Thank you so much for joining us tonight. We will be posting a video of tonight's presentation on the Bateman Horn Center YouTube channel within a few days. Our speaker tonight is Dr. Elizabeth Sherlock. Dr. Sherlock received her undergraduate degree and law degree from BYU and her PhD in counseling psychology at the University of Utah. After receiving her PhD, she spent her career as a military psychologist in the Air Force, finishing her last tour at Hill Air Force Base, where she retired as a lieutenant colonel. During her Air Force career, she gained a wealth of experience as a therapist in both outpatient and inpatient units doing therapy, evaluations, and substance abuse treatment. Dr. Sherlock has been a caregiver and experienced ME/CFS in several close family members for many decades, and will share tonight her thoughts on maintaining hope in chronic disease. We are also pleased that she will be working with the Bateman Horn team to provide assistance to patients and caregivers who are facing the severe challenges that this illness brings. Please welcome Dr. Sherlock.
Hi, I'm Dr. Elizabeth Sherlock, and I'm a psychologist. I'm new to the Bateman Horn Center, but I'm not new to ME/CFS. I appeared at the Bateman Horn Center a few weeks ago and asked if I could volunteer some time for them. As I talked to Dr. Bateman, we discovered that we both grew up in a little town south of here, Provo, you might have heard of it, and that we grew up in the same neighborhood. Her older brother was in my high school class, and so we had quite a few things in common. She knows my younger sister, go figure. But there was one other thing that we shared, which is we have both had a loved one die from ME/CFS. Interestingly, both of a lung infection, which is kind of a coincidence. So we had a bond there. So Mary Ann, the education director, asked if I would give a talk. She said this would be a getting to know you kind of talk. So it's going to be a little different. It's not going to be the sort of clinical talk I would normally give, but something more inspirational rather than informational. And so you don't need to take any notes. There's not going to be a test after. Just sit back and soak it in. So a little bit about the title of my talk. Kind of weird, huh? It comes from a poem by Rumi, who's a 14th century Sufi poet who writes beautiful poetry. And this is the poem. Come, come, whoever you are, wanderer, worshipper, lover of leaving, it doesn't matter. Ours is not a caravan of despair. Come, even if you have broken your vow 1,000 times, come yet again. Come, come. The reason this appealed to me was first that we're all on a journey together. All of us are affected, either directly or indirectly, as patients, as caregivers, but we're all in this together. And it can be a slow journey, which the picture of the caravan elicited for me. We're slowly moving together. At times maybe it feels like we're not moving at all, but we are slowly moving through our lives, undulating up and down, some riding, others walking beside, and we're going through an inhospitable landscape, a desert, a place we don't want to be, not a pleasant place, for sure, a place we didn't choose, and towards a destination that is unknown. Also, despair stalks us as we slowly move forward. Despair stalks us, but we don't have to pick it up. We don't have to carry it, and thus ours is not a caravan of despair. But we know it. Yes, we know it. So let's back up, and I'll tell you a little bit about my journey to this place. I first encountered ME/CFS when I was 19 years old, and I shudder to tell you how many years ago that was, a long time ago. I was a senior at BYU, and I met a young man from Orem. But his mother, Ellen, had a mysterious, debilitating chronic illness. She had come down about 5 years earlier with acute kidney failure, and she attributed it to pesticides that the neighbors had sprayed on their bushes or something. And she had almost died from this kidney failure. It was touch and go for a long time. But then she came out of it, although she never really got completely better. When I met her, she was up and around at times, and then at other times not. And this illness continued for the rest of her life. She lived to be 79, so that's pretty good. But you know the symptoms: fatigue, insomnia, mental fog, pain, digestive issues, mental health issues, everything. And she'd be okay for a few days or sometimes a few weeks, and then she'd be bedridden for weeks or months afterwards. And nobody could diagnose it. Sometimes they thought she had lupus, and sometimes they came up with different labels, but nobody really understood it. So her son, Louis was his name, and I eventually married, and we had a son named John. Not long after John was born, when Louis was 26, he began to complain of feeling sick. I'm sick. However, no doctor could diagnose what the problem was. He had diffuse pain, he had fatigue. Back then, nobody had heard of chronic fatigue, at least nobody that I ever encountered. I'd never heard the term. And he had surgery, he did this, he did that, and nothing seemed to fix it. And we eventually divorced. He moved away to California and remarried, and he had a daughter, and her name was Jenny, and we will encounter her again. And I went back to school and got my PhD in psychology and joined the Air Force, lived all over the world, remarried, and although I didn't see much of Louis, I saw his parents whenever we'd come back to Utah, and they kind of kept me informed how he was doing. He never did get much better, and when he was 53, he died of heart failure. And he was married at that time to his third wife. And no one in the family realized that he and Ellen had the same thing. They had presented quite differently. The illness was misunderstood. Nobody really understood what was going on. Not long after Louis' death, this was about in 1998 or 99, my son, John, who was then 26, started having symptoms. It started out with eye problems. He had keratoconus. And interestingly, that was the first symptom Louis had had, although he had been younger. That's what had kept him out of the draft, is he had this eye problem. And at first, John's symptoms seemed random and unrelated. But one day, he was picking his hands. He was going like this. And because he had some kind of psoriasis thing, he'd been to doctors, nobody could fix it, nobody could diagnose it. And it dawned on me, I said, you know, Louis used to do exactly the same thing. And the light went on. It dawned on me and us that John had the same thing that Louis had, and Louis had had the same thing that his mother had had. And so John's journey started, and my journey continued with this illness. About 2 years later, Jenny became ill. So it's clearly something that runs in my ex-husband's family. And although it doesn't always run in families, apparently sometimes it does. And again, you know, no actual diagnosis back then. Nobody understood it. Nobody knew anything to do. And my son John, he, like most people, he waxed and waned. He had good periods and bad periods. He's kind of a computer nerd a little bit, and when he really got to where he was home all the time, he started researching. He estimated that he read 22,000 articles trying to figure this out, and he tried everything he could try, every diet, every medication he could get his hands on, you know, through the internet. He tried everything. And finally, he came to the conclusion that nothing was really going to fix this, that, you know, he just didn't know enough to fix it. And, but the one thing that he did have, that Louis really didn't have and Ellen didn't have, was he didn't have anybody in the family that was skeptical about the fact that he was sick. We had seen it for a long, long time. And so, come in. And so we fully understood what this illness was about and how sick he was. And this past January, when that bad flu went around last year, he got that flu from me, sadly, and he died about 3 days later. His immune system was just gone. And he'd been very sick for about 2 years at that time, maybe 2.5 years. And he was very tired, and he had made it very clear to us. He says, you know, don't you take me to an emergency room. If I get something, I want to be done. I'm so, so tired. And so I don't know if they could have done anything, but we didn't, and that's what he wanted. I hesitated to tell this story because it doesn't have a happy ending. And, you know, Marianne said, well, I think people still want to hear it, and even so. And I think John would want it told, partly to be remembered, and partly for how it might help others who are facing this illness. As he got sicker, we talked often about death and about how to face it and about how to find a life when you are confined to the house. He never got to the point that he couldn't walk all the time. There were times he couldn't, but most of the time he could get around. Most of the time he could eat, although not always, towards the end. And, but he'd been, you know, like everyone. He'd been active, he'd been doing things, you know. He had had normal expectations for his life, and you have to find a different way to be in the world. And so we talked about that. So, on to another poem by Rumi. This we have now. This we have now is not imagination. This is not grief or joy, not a judging state or an elation or sadness. Those come and go. This is the presence that doesn't. What is this presence that doesn't come and go? Who are you? In a wonderful movie called The Secret of Rowan Inish, I would have loved to embed the clip. I had no clue how to do that. Even my husband couldn't figure it out. He's like, I don't know, I can't figure out how to do it. It's on YouTube, but we couldn't figure it out. Little 8-year-old Fiona Keneally, she speaks to a distant cousin that she hasn't met before. And she says, I'm Fiona Keneally. Do you know my father? And his reply is, I know you. I know you. I know you. I know you, he says, and you're after something. He knows her when she doesn't even know herself. And she has no idea what she's after, what she's thinking. What does it mean to know yourself? I hear that all the time. Well, know yourself. What in the heck does that mean? What does it mean to know someone? To experience the presence that is not imagination, but is real. Here, now. Some of you may know about a filmmaker named Morgan Spurlock. He was the filmmaker that became famous for eating only at McDonald's for 30 days, if you remember that. Well, he went on to make a whole series of 30-day films, did different unusual things for 30 days. And one of these, he went to the Navajo Indian Reservation. He thought, well, that would be kind of different. And he wasn't expecting much, maybe a few hogans, it was remote, maybe a little different way of life. But after experiencing what went on there and a variety of rituals, including a sweat lodge and some other things, there's a very heartwarming scene at the end. He's trying to leave, and he's getting in the pickup truck, and tears are streaming down his face. He did not want to leave that remote, poor, the place that looks like nothing. And he says, I have never felt so present. I have never felt so present. He experienced that presence that doesn't come and go, that is profound and deep, and that we all carry inside us. In our society, there are so many distractions. We are distracted to distraction by distraction. I think T.S. Eliot said that. So many judgments, so many expectations, so many masks, so many stresses and worries that our essence, our presence gets buried. It gets lost, it gets hidden under so many layers of meaninglessness. And as you all know, when you have to face an illness, a long-term, possibly fatal illness, our essence has to be found, has to rise to meet us, to carry our baggage on the caravan as we slowly move forward. And why? Because we're all after something. We're after something to sustain us through the pain and sadness and losses that we bear, that we are all bearing together. So there's a Simon and Garfunkel song, and you're so lucky I'm not going to try and sing it. The Boxer. And it goes, I am just a poor boy whose story's seldom told. I've squandered my resistance on a pocket full of mumbles. Such are promises. And the next line goes, all lies and jest, and a man hears what he wants to hear and disregards the rest. But I like the line about squandered my resistance. Think about that. What are we squandering our resistance on? Especially when we don't have very much resistance to squander. What are we spending our energy on that doesn't matter, that relates to maybe our pride or other issues, our inability to sort out what really counts, what really feeds our soul, what helps us know the you inside? We are squandering our resistance, what little we have for what? As Rumi says in another poem, you can see I'm a big Rumi fan, there is some kiss we want with our whole life. We're after something. There is some kiss we want with our whole lives. We all need something. And it takes deep listening to begin to discover it. Deep, deep listening, both to ourselves and to those around us. Moments of silence and focus when our presence reveals itself. Maybe just a little. But we know we have touched something real and precious inside. Moments that are sustained by having courageous conversations with ourselves and with those who care for us. Moments that strip away the pretenses and let the you shine through. A presence which does not need accomplishments or expectations or health or money, but just being who you really are. That's how you face the day. We are in a new place. We have to inhabit it, find it, make it home, even though it may be a place we never wanted to go. It's a place of losses and sadness, but also a place of new understanding, and it requires different skills, different priorities, and a new viewpoint. We need to let other people in, to accept help. How many of us resist help? We have to be independent, to do it on our own, when well-placed assistance could make your journey much better. Sometimes small help can lead to greater independence. But oh, it is hard to make an unpleasant place home. It's hard when you're in pain, when you're so tired you can hardly sit up, your head hurts, and things look very bleak. It takes a new kind of listening to your body, a delicate, deep listening, and an acceptance that your body is not the same as it once was, that your body is communicating to you and giving you messages of utmost importance. Your limits are real and require a deep respect. And yet, some of you may remember the Apollo 13 mission to the moon. You might have seen the movie, Apollo 13. Partway to the moon, there was an explosion in the fuel cell, and the ability to make electricity was damaged. 2 oxygen tanks, 2 hydrogen tanks, 3 fuel cells, and 1 of their communication antennas were damaged. They radioed back to headquarters the famous line, "Houston, we have a problem." And back on Earth, the rocket scientists started a mad dash to try and figure out how to save the crew. And after a long list of what was damaged on the ship, the flight director, Gene Kranz, finally said, "What do they have that works?" And they put together everything they had that still worked and were able to move to the lunar module and get back to Earth. The turning point was when they stopped focusing on what was damaged. Of course, they had to understand this first, and began to look at what was still good. And from this, they fashioned the workarounds that saved them. Finding what you have that works, what is still good, is important too, as important as respecting the parts that don't function so well anymore. Finding what is still okay can help carry you forward, help you find your way when so much seems lost. And now a word for caregivers. I'm assuming we probably have some caregivers here. I once had a client, a boy about 10 years old. He played sports, I think it was Little League or something like that. And he described how, when the team lost, he could understand losing. He could bear the disappointment just fine. But his parents became so upset, so concerned that he might be disappointed, that it amplified their disappointment, and he felt like he had to carry all of that. In an attempt to protect and empathize with him, they actually were projecting all of their emotions onto him. He said, I can live with it fine, but it's their disappointment that I have such a hard time living with, coping with. There are many losses, past and future, with this illness. They're yours and caregivers, as well as your child's or spouse's or parents'. And if you can own your own grief and possibly find a way to carry it yourself, not making your loved one feel like he or she has to protect you and carry your grief too, you'll do them a great service. It's a delicate balance that requires honesty in those courageous conversations which bring us in touch with each other and with ourselves. As the author Amy Tan said so eloquently, I found in memory and imagination what I had lost in grief. So we are on a journey together. We didn't ask for this journey. We don't want it. And yet here we are, riding some camel as it undulates slowly across the desert and some walking beside. Yet we're all moving together on this confusing, maddening, heartbreaking trek whose destination always eludes us. Maybe it's just a mirage. Maybe it's just over the next hill, just out of sight. David Whyte has written a poem, as you can see, I kind of like poems, called Finistère. Finistère is a French word that means the end of the land. And if you look at the map of France, there's a sort of peninsula that juts out into the Atlantic, and the Finistère is the very end, what the British would call Land's End. The road in the end, taking the path the sun had taken into the western sea, and the moon rising behind you as you stood where ground turned to ocean. No way to your future now, but the way your shadow could take. Walking before you across water, going where shadows go. No way to make sense of a world that wouldn't let you pass, except to call an end to the way you had come. To empty your bags, to sort this and to leave that, to promise what you needed to promise all along, and to abandon the shoes that had brought you here right at the water's edge. Not because you had given up, but because now you would find a different way to tread, and because through it all, part of you could still walk on, no matter how, over the waves. So we will still walk on and make something of our lives together, even if that looks very, very different than what we had thought it would be when we started out. So that's it. So we have time for a Q&A if anybody has any questions or comments.
So, for your son, during his illness, I'm not clear on how many years it was that he was sick altogether, but what did he find most helpful about it, to help him get the courage to go on and not to despair?
So her question was, what did my son find most helpful to get the courage to go on and not to despair? And I think there were a number of things. He was sick for, he was 45, so he was sick for about 19 years. And of course it started out slowly, and over the years it got worse. And you know, one of the things that he did, he read a lot about the afterlife. He was not a religious person, but he read a whole bunch of books about various channelers and people like that. And I think that gave him some degree of comfort. And then he was a striver kind of person. And I think that he just, although there were certainly times that he'd say, I'm so tired, you know, I really want to give up. But it just wasn't in his nature to give up. And he realized, especially the last couple of years, that there was not going to be a cure in his lifetime. But one of the things that really meant a lot to him is that his half-sister Jenny has worked with the people at the Open Medicine Foundation down at Stanford. And Ron Davis down there is doing a study of 20 severely ill patients. And he and Jenny are both part of that study. And so he got to submit his blood for that study. And he felt like it was so important because clearly there's some genetic something in his case and in his family. And he had been quite distressed about the fact that he was probably going to die and nobody was going to look at it. And so when this opportunity came up, that really, you know, helped him feel like he had really contributed something. And so those were some of the things that helped him.
Do you have any other advice for caregivers?
Well, now that could be a whole other talk, couldn't it? Advice for caregivers. I think the number one thing for caregivers is to understand the waxing and waning nature of this illness. Sometimes people are up and around, and you think, what's going on here? And then other times they can't even move. And it's very confusing, I think, for people watching. My other son, he just 3 days before my son died, he said, he's going to live another 20 years. It's like, that's how it looks, you know, and then something happens, and that's not the case. And so I think that's one of the things that is most confusing, and is to understand that people need to listen to their own bodies, and they have to respect that. I mean, if you're too tired to stand up for 10 minutes, you need to sit down. You know, you don't want to look at the person next to you that's standing up and say, well, I should be able to do that, right? No. If your body's saying sit down, you need to sit down. And on Friday, I went to the, Dr. Bateman gave this lecture for the doctors, a 4-hour lecture. And it was very informative. Every symptom she talked about, my son had, plus a few that she didn't get to. But one of the things that was very interesting was this issue with blood pressure. There's a dysregulation of blood pressure, and people cannot stand for a long period of time. And I think that's hard for caregivers sometimes to understand. That things that seem so simple, you know, to us, are not simple. But one day, maybe they are, but the next day, they're not. And to, you know, to really listen to what the patient is saying and say, okay, you know, and respect that, and encourage them to respect it too. Because this is not an illness where you want to push through. That's the last thing you want to do. That is going to crash you. You know, you have to have this respect for what your body's telling you.
So I have a little opposite problem. I am a caregiver, and my daughter will tend to push her illness too hard. And I don't want to project emotions on her, but I can't help but to say, you need to rest, you know, or you're pushing too hard, you know. I mean, is that the right way to handle that, or is there a better way? Because, you know, I can see it coming, and she's just so motivated that it's hard for her sometimes to throttle back when she needs to.
So she's asking, this is a caregiver whose daughter often does not respect her illness and pushes too hard. And whether it's, okay to push back and say, no, you've got to rest. That's a different thing than looking at your daughter and bursting into tears. I think that's wise advice. Of course, those of you who are parents know that kids, the last person on earth they want to hear anything from is a parent. So if there's a friend that could say that, you might get farther. But I think sometimes it's just hard for caregivers to really understand how the illness waxes and wanes. It sounds like you've got a good handle on that, but she's young, and so she's thinking she can do more than she can do. Yes?
Well, as a person with the illness and also a caregiver, I think everybody has a right to decide what they want to do. So for me, I make that decision every day whether I want to push and be in pain or I want to stay down and possibly be depressed. And I get the right to decide that. And my son has the right to decide that. He recently pushed doing something, but he was so happy doing it. And I knew he was overdoing it, but I didn't want to tell him he couldn't do it, or that I knew he would crash, because there's not a lot of happy
That's
with
true.
this illness. So while he was happy, I let him enjoy it and comforted him when he was in pain. And he will have to learn for himself what, not only living within the parameters of it, but deciding whether he wants to push through or not. It's his choice.
And there are certainly times when you weigh the options and say, yeah, this is worth it to me. I'm going to do it.
Yeah.
And my guess is that he probably at least had an inkling that he was pushing, but it was worth it. It
Yeah.
was worth it. So,
He's only been diagnosed now for a month to 6 weeks,
Mhm.
so this is new.
yeah.
He's been sick for a long time, but the diagnosis is new.
Right. Well, so it sounds like you've got a handle on listening to yourself and knowing what you want.
Mhm.
And that's great. But some people it takes a while
Yeah.
to get there.
I have a friend who has closed herself off in a climate-controlled room, stays in her pajamas, doesn't do anything with her kids, and that's her choice. For me, not what I want to do with my life. So, we have to make that choice.
Yeah. Marianne?
Yeah, I wondered if your entire family was always supportive and how you talked to people either in family or, extended family who weren't supportive. What do you say to them?
Well, certainly back when,
Repeat the question, sorry.
okay, she said she wondered if the family was always supportive and what to say to family members that may not be supportive. Certainly when Ellen was sick, one of her sons just never believed she was really sick, said, oh, this is all in her head, she's just making it all up. And her husband, though, was very supportive. And I think that the rest of the family is kind of more or less supportive of her. But again, there's so much more information out there now, today. Today you can point people to articles and books and the movie Unrest and things like that and give people information that can help them understand where, back in the 70s and 80s, there wasn't any of that out there. And so I think it was even more confusing for people. So I would just try and educate people. You can't, arguing doesn't get you anywhere. But point people with the internet, point people to articles and say, you know, you need to read more about this. You need to understand it. Because if you understand it, you'll have a different view. But often, you know, especially at the beginning, things are confusing and contradictory, and, you know, who knows what's going on. And it is hard for people to understand. So, any other comments? Yeah.
Do you have any thoughts on how it's best for us to adjust to the fact that many people don't believe that we're sick, including physicians and family members, strangers, whatever? And, you know, it's one thing that I find very difficult to face, and I have a tendency to avoid people or to avoid talking about it. And so I sometimes come across probably as very secretive because I don't want to get into talking about it because I'm afraid that it's going to turn into a very unpleasant situation. I wish I could develop an elevator talk, if you know what that means, to describe it quickly to people who may or may not be sympathetic. Do you have any thoughts on any of those issues?
So her question is, do I have any thoughts on how to deal with acquaintances, people you encounter that don't understand the illness and that, you know, may be clueless about what you're going through, and that she often avoids people that she feels are going to be that way because you don't want to get into a long discourse about the whole thing. And I think you mentioned physicians. With physicians, I think it's very important that you take the time, make the effort to try and educate them, because not only for you, but they're going to see other people too. And the more that they understand, the more effective they can be in helping you, but also it will translate into their other patients as well. And from our perspective, realize that they don't get any education in medical school on this. And our healthcare system likes quick cures. You know, that's the American way. You know, 3 easy steps, boom, 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 and everything is fixed. And chronic illness is very frustrating for physicians because they want to feel like they fixed it, and it doesn't fix. Maybe someday, but not yet. And so I'd certainly make the effort in that circumstance. And I think you just have to play it by ear. But one of the things you can say now is you can say, I have ME/CFS. If you don't know what that is, Google it and read about it. And you could say, it's a debilitating illness that sometimes is worse and sometimes is better. Today I'm up, I'm having a pretty good day. That's not always how it is. And, you know, leave it at that and let them let them do the work to understand it more. Yes?
So my son, who's just recently diagnosed, is also autistic and has anxiety disorder and depression. And the diagnosis of his illness has made him feel very suicidal. So we would like to hear some reasons to continue on with life. This is not, you know, the worst thing that could happen to a person. So what are some things that you would recommend to help him through this beginning hurdle?
So can you hear her? Okay, so because she has a pretty good voice. So her question is that her son is recently diagnosed, and she wants to know how to help him through the initial hurdles that he's facing with this. And there's not a simple answer to that question. You know, one of the things to do that we talked about tonight is for you to be as present as you can with him and to hear him and help him, to the extent he can, express how he's feeling. And to realize that so many of the expectations we have in life, like, oh, you're going to graduate, or you're going to, do this or do that, they're not what people really are. The essence of you is something quite different than that. And what you love about him is the essence of him. And that he's embedded in a larger context, as we all are. The family of man, and your family, a smaller version of that. And that in one sense, our lives are not entirely our own. We're all carried by the larger context and the connections and the love that we have for each other. And that's what matters. And so to communicate that to him and help him feel that and realize that that's what's going to help him go on. Now, there's not, I can't tell you 3 easy steps to do that.
Right, but, okay, so he's got school, he's got a job he loves, he's got a girlfriend, he's only 20. Do you just give up and don't do any of that? Or how do you get back into some sort of life of, not expecting him to do everything,
Mm-hmm.
but also want him to feel like getting back into some of those things would also be helpful and less depressive than just doing nothing at 20.
So I don't know if I can really summarize that.
You heard that one pretty good.
Okay. I think that you want to help him preserve as many of those things as possible. Absolutely, doing nothing that's the very last choice. But you will have to help him and listen to him prioritize those things, because there may not be enough energy to do them all. And so what matters the most? And so focus on the things that matter the most and try and preserve as much as you can. But realize you probably can't preserve everything. But sometimes we get caught up in doing a lot of things that are not the things that really matter to us. And, that was kind of the point of my talk.
Right.
Find the things that matter the most and use your energy towards those. And don't get pulled into, all of the nonsense of life that, that eats away at us. It's how things are, but you have to, if you can keep your focus, then you can prioritize and use the energy there is for what really matters. So.
Who is it that wrote the thing about spoons? Have any of you heard about spoons?
No?
What, tell me about spoons.
I can't remember who came up with that idea, but basically if you look at your energy.
So do you want to come over to the mic?
Okay.
So counting my spoons, just in the way that I understand it, is if you looked at the amount of energy you have as a number of spoons, that you use those spoons, they represent the energy. So if you do an activity, say you have 5 spoons of energy for the day, and you do one thing that takes 4 of those spoons, you only have 1 spoon of energy left. And so you know that you need to bring your energy level down to preserve and only use those 5 spoons so you don't end up in a crash. So that's kind of the thought process. I've heard it similar with money. If you have $1 worth of energy a day, you can spend that 10 times, right? So you do little chunks of energy at a time, which is really the best way to do it, rather than spend that $1 all at once. Because then you have no energy left for the rest of the day. You're going to go into debt, for more energy, and you're going to crash, and, it's going to take longer to recover. So that's kind of the concept.
Thank Thank you.
Yeah. While I'm up here, we do have a question from Facebook.
Okay.
And the question is, this I assume is a patient, how do you get over the feeling of worthlessness?
How do you get over the feeling of worthlessness? I think that relates to one of the things that we talked about in the talk, which is the idea that in our society, our society is about doing. When you meet somebody, you say, "What do you do?" You don't say, "What are you?" You say, "What do you do?" We're a society that's sort of addicted to doing, and so when you can't do, then how can you have any worth? And that's the mental shift. It's not easy to make in our society because our larger society does not really support it. But the idea that your worth is inside of you and the essence of what you are is what people care about and is what keeps you going. And it is not your achievements and your accomplishments. It's not your trophies. I think of my mother. She had a stroke when she was, I think, 87. And she could still get around, and she lost some of her words. She was not the same person in some ways. She was very emotional. She couldn't shield her emotions anymore. Something upset her. She would just burst into tears like a little kid. But she was still her. Like that essence of her was still there. And even though, she was in an impaired state for a couple of years like that, we missed her when she was gone very, very much. And so that essence of who you are is what matters, and it doesn't matter all these things you do. And we prop ourselves up with all this doing in our society, and we don't stop and just take a really deep breath and maybe meditate a little bit and say, what really matters to me? What am I? And I think that's where you find your worth. Now, is it as simple as that? Well, go find it. No, it's not as simple as that. It's a process, and it takes some time, and it takes a shift of focus, and you have to pull yourself away from the expectations that our society lays on people. You have to just pull out of them and say, sorry, society, that just can't be for me. I have to find myself within, and to do that, you have to sit down and be quiet and listen to yourself and not be running around, doing everything all the time. So I don't know if that addresses it entirely, but that's at least a start.
I think it does. There's a comment, there's not a question, but I would like to read this comment to you.
So do you want to come to the mic?
Can you hear me?
Yeah, good.
Okay, I guess I'll go first. My voice doesn't carry, I'm sorry. I need your voice. So this patient says, it hurts when people don't want to listen. I feel ignored. I have my husband, though. They just expect me to be normal. After 26 years, I can't barely move. Their frustrations are projected onto me. And then she says, great talk and thank you. But I thought that you might have a comment on this comment.
Mm-hmm. Well, this goes back to one of the other comments about what about people that don't really understand and that do just expect you to, be like everybody else. And that's where you have to stand up for yourself a little bit and educate them and say, I can't do this. And, if you don't understand it, watch Dr. Bateman's talks and you'll understand it a lot more. That even though I'm sitting here, and if you just took a snapshot of me, you'd think, that's a normal person. I'm not wearing some big thing across my forehead. But that doesn't mean that my body is functioning the way it's supposed to. And you have to, not let those expectations hurt you. Because they can't hurt you unless you buy into them, And if you've really come to a place where, look, I am who I am, and that's good enough and that's okay, and what I do is not part of that, then those expectations fall away. But it takes time to get to that place. It doesn't happen overnight. So. Okay.
Okay, any other questions? All right, I think that's a wrap. Thank you so much, Dr. Sherlock, for your heartfelt journey and your advice. We really appreciate it very much. You had a lot of positive comments online as well. And thanks to those of you who joined us tonight. Safe travels back home. And that's it for tonight. Thank you so much.